Are all surgeries for under eye bags done the same way?
I routinely see people concerned about having puffy under eye bags. They state that the bags under their eyes are always there, regardless of what they do for their allergies or their sinus issues, as well as how much they sleep or how much salt they have in their diet. Puffy eye bags that are always visible are likely due to something we call prolapsed orbital fat. This condition is also referred to as lower eyelid fat prolapse or herniated fat. Lower eyelid fat prolapse is often a genetic feature seen in families and something that can become more significant with facial aging. A condition this common makes lower eyelid surgery to address puffy under eye bags a highly sought-after cosmetic procedure. The procedure to address under eye bags is called a lower eyelid blepharoplasty. Although this term, lower eyelid blepharoplasty, is commonly used, the procedure is not performed the same way by every surgeon. This can be very confusing for people who want to improve their under eye appearance. Some of the most popular techniques are unfortunately prone to undesirable outcomes, such as rounding of the lower eyelids and even complications like lower eyelid retraction and ectropion. I'll discuss different strategies and techniques for lower eyelid surgery. I'll cover some of the key points of anatomy and surgical techniques so you could understand my recommendations. I'll discuss the art of performing lower eyelid rejuvenation in a way that minimizes your risk for complications and helps you look refreshed while preserving the natural character of your eyes. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I have been a strong advocate for natural results and preserving individual character so people who know you can tell why you look better after any type of procedure I perform. I do procedures for lower eyelid rejuvenation every day, and my approach to lower eyelid blepharoplasty is based on strategies to minimize risk, achieve natural results, and to facilitate recovery. I perform a wide range of cosmetic eyelid surgeries, including specialized procedures that are not usually performed by general plastic surgeons, such as eyelid ptosis, lacrimal gland prolapse, and eyelid retraction surgery. I'm also known for performing surgical revision for complications of procedures performed by other surgeons. So what are the main concerns for people who come in for lower eyelid rejuvenation? It breaks down to three things. 1. Puffy under eye bags. 2. Under eye wrinkles. And 3. Under eye dark circles. The key to defining any solution is to first accurately define the problem. Let's start with the puffy under eye bags. As I mentioned earlier, the puffy under eye bags are caused by prolapsed or herniated fat. In order to gain access to these fat compartments, the conventional approach to surgery is to make an incision below the eyelashes and to separate the skin and supporting muscles to get access to these fat compartments. This approach is called a transcutaneous blepharoplasty. In my opinion, this approach of dissection results in a loss of the intrinsic strength of the eyelid structure, which is more strong, intact, than after the layers of the eyelid have been separated. It's like the strength of a material like plywood, which is made of thin layers of wood that are weak individually but have strength when glued together. Loss of eyelid strength can cause the eyelid margin to sag. I prefer to perform lower eyelid fat modification from the inside of the eyelid using a technique called transconjunctival blepharoplasty. Although this technique is considered to be more technically advanced, I make the effort in order to protect and preserve the integrity of the tissue layers that would be separated from an external or transcutaneous blepharoplasty approach. The art of fat modification is in performing sculpting and repositioning of the fat such that you appear as if you never had bags under your eyes. Addressing under-eye wrinkles is where a lot of complications can occur, and I'm consulted for this type of issue frequently. It's common practice for surgeons to remove skin with the expectation that the wrinkles will be smoother and that the skin will be tighter after this procedure. Unfortunately, this particular maneuver can contribute to rounding or retraction of the lower eyelids. In some situations, the eyelid can even evert, resulting in a condition called ectropion. To make matters worse, not only does the cosmetic outcome not look good, but the patient can also experience dry eyes and other forms of eye irritation requiring ophthalmic management with eye drops and ointments. So how can this situation be avoided? Well, there are two issues that should be addressed. The first is the assumption of skin excess. The skin may appear to be excessive if the supporting tendon, called the lateral canthal tendon, has become more lax. This situation would be an indication for addressing the tendon as opposed to removing skin. If I see that the patient has lateral canthal tendon laxity, I'll perform a procedure called a lateral tarsal strip to restore the stability of this very important support structure. The second issue is related to the appearance of wrinkled skin, and it's to differentiate skin quality from skin quantity. Skin that appears to be redundant is more likely to benefit from procedures such as fractional laser to induce collagen production and restore the skin surface with new layers of skin that look smoother. Skin removal can potentially cause a skin shortage that results in the eyelid margin being pulled downward, again resulting in eyelid ectropion or eyelid retraction. In patients with darker skin types who would not be candidates for laser, I can stimulate collagen production with a radiofrequency device like Pelave. I further enhance collagen stimulation with platelet-rich plasma, or PRP. Platelet-rich plasma is the concentration of wound healing and growth factors found in the blood which are activated after an injury, such as a simple cut. Another benefit of PRP is the production of new blood vessels, which can further improve skin quality. Dark circles under the eyes are typically associated or caused by sun damage, volume loss or volume deficiency, and a decrease in skin quality. There are times when laser technology used for wrinkles can also be used at the same time for discolorations under the eyes, often seen with sun damage. For people with darker skin, I often use PRP to address skin quality and skin discoloration. It appears that collagen stimulation and improved circulation to the skin results in more refreshed and lighter appearance of under-eye dark circles. To further develop the topic of all lower eyelid surgeries are not the same, I look at bone volume and projection below the eyes and the cheeks. I've observed that prolapsed or herniated fat often coexists with a deficiency in bone projection under the eyes and in the cheekbones. This deficiency in bone projection can be due to genetics or aging, as well as a combination of the two. It makes sense to reduce fat projection with surgery and to enhance bone structure projection to create better balance and harmony. In the past, this bone structure enhancement would have been achieved with surgical placement of facial implants. A newer technique called structural volumizing, which was derived from the principles of facial implant placement, has made bone projection enhancement safe, predictable, and without the downtime and risks of facial implant surgery. So instead of implants, I use long-lasting hyaluronic acid fillers, such as Juvederm Ultra Plus and Juvederm Voluma, which are placed using a specific method. This method allows for better projection and definition, as opposed to the pillowy and rounded appearance associated with the conventional approach to placement of fillers. As far as facilitating recovery, I perform lower eyelid surgery using local anesthesia with light IV sedation. Many of my colleagues prefer to perform eyelid surgery with general anesthesia, which is associated with side effects including nausea, vomiting, constipation, brain fog, and prolonged recovery. By contrast, our patients are fully alert and comfortable after surgery. They generally return to work in about a week after surgery with minimal to no bruising. It should be abundantly clear at this point that lower eyelid surgery is not a standardized procedure. It's important for you to have a clear understanding of your specific issues so you have a clear strategy and minimize your risk of experiencing an undesirable outcome. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.